Hi, my name is Mary. I'm from Assiniboine Community College. I'll be your student nurse for today. So before that, I'm gonna close the curtain to provide privacy. Okay. So I'm just gonna wash my hands as well. So for today, I'll be doing your abdominal, your musculoskeletal, and your neurological assessment. But before that, can you state your name and your birthday?
Nisha Stavas, December 29, 1999.
Can I check your race as well? Okay, so the purpose of this assessment is just to have an overview of your current health status, and if we find any abnormal finding, I'll make sure to document it and address it to your attending physician. So I just want to let you know that all the results will be strictly confidential. So do you have any questions? Okay, so I may be touching some parts of your body. Would that be fine with you? Okay, so do you feel comfortable? Do you need to go to the washroom before we begin? Okay, so we'll start with your abdominal assessment. But before that, can I ask you some questions? Okay, so do you have any changes with your appetite lately? Do you experience any abdominal pain? Any nausea, vomiting? Okay, so do you have any difficulty swallowing? No. So do you have any past medical history regarding your gastrointestinal? No as well. So are you currently taking any medications? Okay, good. So can I just ask you to lay down on the bed to start our assessment? And I'll just grab this pillow and put it under your knees. So is your bladder empty?
Yeah.
Okay, that's good. So we'll begin in inspecting your abdominal. Can you just lift up your shirt? Okay. Can you just pull this down a bit? Okay. So upon inspection on your abdominal, I can see that your skin is consistent. It is even and smooth, and there's no lesions or any scars as well. And your umbilicus is in the midline, which is good. And I can see that your umbilicus doesn't have any inflammation, any hernia or protrusion, which is nice. So next is I'll be inspecting your contour. So I can see that your contour is flat and it is symmetric and bilaterally equal. So there's no signs of redness as well, no signs of jaundice. That's good. There's no protuberant or distension as well. So we'll proceed in auscultating your vascular sounds. So I'll be using the bell of my stethoscope, and I'll make sure it's warm. Okay, so I'll start with your aorta. Your abdominal aorta. Then your right renal, your left renal, your right iliac, and your left iliac. So upon auscultation, I didn't hear any sounds, no bruise or murmur as well. So next is I'll be auscultating for your bowel sounds. I'll start in the right lower quadrant, and I'll be using the diaphragm of my stethoscope. Okay. Right upper quadrant. left lower quadrant. Okay, so upon auscultation for your bowel movements, I heard normal bowel sounds, which happens every 2 to 5 seconds, and there's no rushes or tinkles. So next that I'll be doing is percussing your abdominal. So I'll start with your right lower quadrant as well. Left upper quadrant. Okay, so far upon percussing, there's no dullness or resonance. I didn't hear any hyperactivity or infrequency. So next is I'll be doing is the light palpation. So can you just let me know if you feel any pain, any tenderness or discomfort? Any pain? Pain? Any pain? Pain? Any pain? Pain? Any pain? Pain? Okay, good. So upon palpation, there's no pain when palpating. There's no abdominal distension as well. I didn't notice any bumps, any lesions, any scars, which is nice, which is normal. So next is I'll do the abdominal reflex. So I'll be just using this cotton swab. Okay, I'll begin with the abdominal reflexes. So I can see that there's a ipsilateral contraction of the abdominal muscles. That's normal. So lastly, for the abdominal assessment, I will be doing a palpation on your kidney, aorta, spleen, and liver. So I'll begin with the liver. So I'll just put this on your back. Can you take a deep breath for me? Okay, so upon palpation on your liver, I didn't feel any firmness. So I'll proceed with your spleen. Can you take a deep breath for me? Okay, so for your spleen, I didn't feel any firmness or enlargement as well. So we'll proceed to your kidney. So I'll be using the duckbill technique. So I'll start on your right lower quadrant. So can you take a deep breath for me? The other side. Okay, so upon palpation, there's no any changes in size when you're inhaling, which is good. So I'll proceed with your aorta. I'll do your walls first. Okay, so the pulse is present for your abdominal aorta, and the size is in between 2 to 5 to 3 cm, which is normal. So okay, so that's it for our abdominal assessment. So do you have any questions at the moment? So everything in your abdominal is normal. I didn't find any abnormal findings as well. So we'll proceed to your musculoskeletal assessment. But before that, can I ask you some questions? Okay, so can you just pull this down for me? Okay, thank you. So for the musculoskeletal system, do you have any pain on your muscles? Any stiffness? What about on your joint? Do you feel any pain? Any discomfort? Okay, that's good. What about on your bones? Does it cause you any discomfort? No? Okay, that's good. So, can you stand up for me? Okay, so I can observe that you have a stable balance when you're standing up. Can you walk for me? Can you go back in here? Okay, I can see that you have a steady gait as well. You have a good posture. You have a good fit position as well. So that's good. So next that I'll be doing is inspecting your lower and your upper and your uh, lower extremities. So can you just pull up your sleeves and your other. Okay, so I can see that there's no lesions. The color is equal. The color is consistent with your upper body, your upper extremities. There's no deformities as well. And for the size and shape, both is in normal size and shape. So for the lower, can you just, is it possible if you can pull up your pants? Okay, and your other pants as well. Okay, so for your lower extremities, I can see that both are in normal size and shape as well. The colors are consistent for both sides. There's no presence of lesions. The hair are evenly distributed. There's no masses. There's no deformities as well. So for your upper extremities, I didn't see any lesions as well. There's no masses. There's no deformities. Okay. So next that I'll be doing is palpating your joints. So just let me know if you feel any pain. I'll start with your shoulder. You feel any pain? Then I'll do your epitrocular nodes. You feel any pain? What about on your elbow? Pain? 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 Your fingers, pain? Okay. So can you stand up? So do you feel any pain? On your other, do you feel any pain? Okay. So I'll do your knees. Do you feel any pain? Any pain? Then for your ankle, you feel any pain? And the right toes, any pain? Okay, on the other side, do you feel any pain? On your toes, do you feel any? Okay, so upon palpation, you didn't feel any pain, which is good. So next that I'll be doing is for edema. So as I was palpating earlier, I didn't notice any edema throughout your body, which is good. So next will be the palpating of your pulse. So I'll start with your brachial. It's around this area. Show me both sides. Okay, I can feel your pulse. Pulse is present and equal for both sides. Then next is your popliteal. Okay, I can feel the pulse. It's present for both sides and it is equal. So next will be your dorsalis pedis, which is, I just need you to remove your shoes. Okay, I can feel the pulse. It's both present and equal on both sides. Next will be the posterior tibialis. Okay, so the pulse is present and equal on both sides as well. So for your musculoskeletal, everything is normal. So we're gonna proceed with your range of motion. So for your range of motion, we'll start with your neck. So can you look down for me? Can you look up? Can you put your ear on the shoulder? On the other side. Can you bring your chin toward your shoulder as well? Okay, the other side. So I can see that you don't have any pain when doing the movements, and you can maintain flexion as well. So next is your shoulder. So I just want you to put your hands on the back towards your scapula. That's the internal rotation. Then on your head, that's the external rotation. Can you move your arm up? Okay, that's the abduction. Then can you bring it on the side? That's the adduction. And can you raise your hand up on the side again? Can you stand up for me and move it back? Okay, good. So for shoulder, I didn't see any pain as well, and your range of motion is not limited. So next that I'll be doing is your range of motion for your elbow. So for your elbow, can you just do it? Can you just do this? Lift your arm. Can you extend? Flex? Okay, good. So for the elbow, we'll be testing it on the table. I think it's so high for you. Okay, so I just want you to do this. Okay, so this is pronation and this is supination. Okay, good. So we'll proceed with your wrist. So I just want you to raise your arm. Can you raise your wrist like this? Lower your hand. Okay, good. And can you lift? Can you put your hands here? Can you point it towards inside and outside? Good. So for your elbow and your wrist, there's no pain as well, and your range of motion is not limited, which is normal. So we'll proceed with your fingers. So can you put your hands like this? Can you lift your fingers without moving your wrist? Can you move it down? Can you clench your fist? Can you open it up? Can you touch your fingers using your thumb? Okay, perfect. Okay, so upon observation, there's no pain as well. Your range of motion is not limited. So can you lay down again for our hips? Okay, so can you lift up your feet, your right leg, your left leg? Can you move it towards the side? And the other leg. Can you bend your knees towards your chest? The other leg. And one more time, can you do this and that, and on this side? Okay, on this side and on this side. Okay, perfect. So next, so I'll be doing, can you stand up for me? Will be your knees. So can you stand up? Is it possible if you can flex and extend? Okay, so there's no pain, there's no contracture as well. The range of motion for your ankles, can you point it towards your nose, point it towards the floor? Can you turn it inward, outward, your other foot, upward, downward, inward, and outward? Okay, that's good. So we'll be testing the range of motion on your toes. Can you just remove your socks for both feet? Okay, so can you spread it out? Can you put it up and down? Your other foot. Can you down, up, spread it out? Okay, so everything is good. So before we proceed to your neurological assessment, I'll just do some resistance. So can you point your chin towards the shoulder, your shoulder, resist, the other, resist. Okay, so for your elbow, can you extend it, resist, resist. Okay, so can you lay down, doing your hips. Okay, can you lift up your head, your feet, resist, resist. Okay, you're good. Then for your wrist, can you lift your arm? Can you resist, resist? Okay, good. For your knees, can you flex, resist, resist. Okay, so for your ankle, can you point it up, downward, downward. Okay, resist. Your other foot, point it downward, resist. Okay, good. So we'll proceed to your neurological. Everything was good with your musculoskeletal system. Everything was normal. Your range of motion has no limitation, which is good. So we'll proceed to your neurological cranial nerve. So for cranial nerve number 1, that's your olfactory, which is in charge of your sense of smell. So in order to test that, I'll just be putting something under your nose and let you identify the smell. So for the cranial nerve number 2, which is the optic nerve, we already did that with the eye assessment. That's the vision acuity test and the confrontation test, which was your result was all normal. So next will be your cranial lobe number 3, 4, and 6. For number 3, that's your oculomotor. For number 4, that's the trochlear, and the number 6 is the abducens. So for that, we already did that during your eye assessment, and everything was normal. It was about your pupil size, the perla, and the 6th cardinal position. So for the cranial nerve number 7, that's your facial nerve. So I'll ask the patient to raise your eyebrows, smile, frown, and close their eyes slightly. But before I forgot to mention the cranial nerve number 5. For the cranial nerve number 5, it is the trigeminal nerve. So to test the sensory function, I'll just be testing your light sensation using the cotton balls. And for the motor function, I'll just ask you to clench teeth and palpate the muscles for both sides of the masseter to see if it's equal when moving. So we'll go back to cranial nerve number 8, which is your vestibulocochlear. It is in charge with your hearing. We already did that for your ear assessment, which is the hearing acuity test, and the whispered voice test, which is everything was normal. So we'll proceed to cranial nerve 9 and 10, which is the glossopharyngeal and the vagus. So I'll just ask the patient to say ah or yan, and I'll just put a tongue blade on the tongue to check out for gag reflex. And for the sensory function, I'll just ask the patient if she has any loss of taste. Okay, so for the cranial nerve number 11, that's your spinal accessory. So I'll just ask the patient to move her head on the side for both sides, and then put some resistance, and that's it for the cranial nerve number 11. So lastly, for the cranial nerve number 12, that's for your hypoglossal, that is in charge for your tongue movement. So I'll just ask the patient to say light, tight, and dynamite, and that's it for your cranial nerves. So do you have any questions? Okay, so I'll proceed to your neurological sensation. So first is I'll be testing your spinothalamic tract. So I'll be using this cotton swab. In case you feel this on your skin, this end, this will be the dullness. This is just to test your general sensation. Then this side will be the sharp. This is to test your pain sensation. So can you close your eyes for me?
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull.
Okay, so overall, your sensation is good. You pretty much sense everything. You just missed two, which is okay. So next that I'll be doing is testing your light touch. So I'll be using this cotton swab. So just say yes or no if you ever feel it touching your skin.
No. 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 No.
Okay, so as for that, your light touch sensation is good. It works well. So we'll proceed to your position sense. It is to test if you perceive any passive movements. Okay, so can you just put your hands on your legs, and can you just identify which way will I move your fingers? So can you close your eyes for me?
Up. Up. Down. Up.
Okay, on your other hand.
Up. Down. Up.
Okay, so everything is good. So we'll proceed to the stereognosis. So can you just close your eyes? I'll just put something on your palm, and can you just identify it?
Cotton.
Okay, then the other one.
Keys.
Okay, so for your other hand, can you close your eyes?
Swab.
Okay, good. So everything is good. So I'll proceed with the alternating movements. So can you just repeat after me? So let's do it a bit faster. Okay, good. So you have a good coordination. Then we'll test your cerebellar function. So can you just put your index finger on your nose and your other hand towards this, and then do this on alternately. Okay, good. You have a good coordination. Okay, so lastly, before we end this neurological assessment, we'll be doing the heel to shin. Can you stand up for me? Can you remove your shoes? So can you lift this up on your knees, then move it downward. Good. Your other feet. Good. So as I can see, upon doing all the assessment, all was normal. I didn't find any abnormal findings, which is good. So your coordination is good. So do you have any questions for me? Do you need anything to clarify? Okay. So overall, all your assessment went well. Everything was in normal. So you don't have to worry about anything. Just in case anything arise, please don't hesitate to contact the clinic. Thank you and have a good day. Thank you for your cooperation.